Hello, everybody. Please help me welcome on Dr. Iris Kerin Orbuch. So, Dr. Orbuch, just to give you a little intro, she is a gynecologist, well-respected gynecologist who specializes in endometriosis and pelvic pain. She's also author of Beating Endo: How to Reclaim Your Life from Endometriosis. She's the founder of Iris Wing's Sanctuary for Endometriosis Surgery and Wellness. She's based out of Los Angeles. And if you don't follow her on Instagram, you have to because her little video clips are hilarious and so helpful, Dr. Orbuch. So she also specializes in advanced laparoscopic surgery, and she was mentored under the guidance of Dr. C.Y. Liu and Dr. Harry Reich. If you don't know, they were both pioneers in the field of advanced laparoscopic surgery. So this allows Dr. Orbuch to be one of the handful of physicians across the states, at least, to be able to perform this advanced minimally invasive procedure, and which also makes you so well respected, Dr. Orbuch. So, welcome to the podcast, and thank you for making some time for me.
Thank you, thank you. I go by Dr. Kerin Orbuch as a homage to my dad. My dad is no longer with us, but he's one of the reasons why I am a physician. So Karen is my maiden name. So I typically go by Kerin Orbuch because I have
Oh,
such pride with that name from
yeah,
my
yeah.
father.
Yeah.
Yeah,
And you spell it differently than how we generally spell it. And even in
correct.
Ireland, we would never, like, if your dad's name was Karen accent,
Uh-huh.
that we would never associate that with a man's name. Maybe
Yeah.
Kelly, but not, it's
Well,
like primarily female.
right. Well, it was my last name. It was our last name. So my dad's last name, my maiden name. So yeah.
So, again, thank you for making some time because I know your schedule is crazy busy, but this is such an important topic and so needed, especially where I am. So, first, if we could spend a few minutes just kind of letting people know a bit about your story and why you got into this, because it is such a specialized area. Like, not many people put so much focus on endometriosis as you do.
Yeah. So first of all, I'm honored to be here. I love raising awareness. I'm super passionate about endo. I'm both a physician, I am an endo patient. I'm a mom of a daughter with endo. So on every level, I'm so committed to raising awareness and helping those who are suffering really beat endo. Hence the title of my book, Beating Endo: How to Reclaim Your Life from Endometriosis. But essentially, I did a fellowship in gynecology, obstetrics and gynecology. And the first time I walked into the operating theater and I saw a surgery for endometriosis, I knew this was my flow. This was my jam. This is where I wanted to be. Was really fortunate, like you said in your intro, to do training with the probably the two best in the world and like pioneers in the field, who both of whom were like mentors and father figures to me, both of whom were at the end of their career. I was more or less both of their last fellows. Like they just shed so much knowledge and like passion, and we still are in touch 20 some years later. And yeah, my passion is really helping all of those who are suffering with endo. I have a particular affinity for teenagers who are suffering. But yeah, it's a devastating disease that's so common, like 10% of women have it. And it's misunderstood as a menstrual disorder or a period disease, when in
Mm.
fact it is so much more than that. Let me know if you want me to get into the more, so much more.
I'd love to know the statistics around teenagers because teenagers often get overlooked and just get thrown on birth control. And
Yeah,
if I'm correct, you had diagnosed endometriosis in your own daughter, which then helped to lead to your own diagnosis
correct.
too. But not many people realize that we hear it all the time. Oh, my teenager's missing school today. She's on her cycle. She's in so much pain. Or I'm making my teenager a hot water bottle to put on her stomach. And just thinking is a bad period. They're
Yeah,
not thinking this could actually be a bigger problem.
correct. You're 100% right. That's endo, period. Like that is endo. And endo is passed on genetically. So if the mom has endo, the grandmother, the aunt has endo, it could come from mom's side or dad's side,
Mhm.
then that child has a 70. So the daughter or the granddaughter or the niece has or even sibling has a 70 to 100% likelihood of having endo.
Whoa.
So endo's super genetic. It's hard enough to get the diagnosis now in 2026. Imagine one generation ago. But if there's anyone who had fertility issues, they had bad periods, they had super heavy period, they had a bunch of gut issues, they just like were fatigued all the time. They had all these like mysterious symptoms that no one could figure out what it was.
Mhm.
Chances are that that's endo. And then we also know that in utero exposure, so when the baby or the fetus is in utero in the mom's uterus, exposure to certain chemicals can induce endometriosis. We do know that dioxins are produced like with bleaching products, that can induce endometriosis. And there's probably like countless other chemicals that it's not like endo funding is like this huge amount of money. Like there's barely any money for funding, but we did discover that. So there was a study of female fetuses that found that about 9% of female fetuses had endo. So
Mhm.
that number is not too dissimilar than what we quote in the general population, which is like not 8%, 9%, 10%, 11, 12%. So it's
Yeah.
the same number. So I often see teens, I love getting the history, or whether I have a teen in my office, a 20-year-old, later today, I think I have a 13-year-old consult, but whether I have a 30-year-old, a 40-year-old, I always go back to, did you have tummy aches as a kid? Were you the one who was like, didn't feel well? No one could figure out what was going on with you. They thought you had anxiety. And often I find that those quote unquote tummy aches, um, started a year or two preceding before one even began menstruating
Mhm.
because the hormones are starting to increase.
Mhm.
And then I often see that like the patient or the mom who's accompanying the teen to my office or the 20-year-old says, "Oh, she was always constipated. Since birth, she was constipated."
Or she was a
And
difficult baby.
yeah, and not everyone has the same symptoms of
Mhm.
endo. And when we get into the symptoms, you'll see there's just such a wide range of symptoms. But that's a common story that I hear all the time. Tummy aches, no one figured it out, eventually diagnosed with irritable bowel, which is kind of a wastebasket term anyways. And it's usually endo, which is the root. And I don't band-aid my patients. At Iris Wings, that's my sanctuary for endometriosis surgery and wellness. We are trying to heal patients from the inside out. We're trying to find
Mhm.
root causes and then allow someone to like beat endo and reclaim their life. Again, hence the title of my book. You can't band-aid endo with a prescription.
It's almost just like everything nowadays. You can't band-aid it. You need the whole lifestyle approach and consideration, and then looking at the individual woman, which unfortunately mainstream is still not really doing.
Mhm.
So you did mention something there that I was going to ask anyway, if it was familial, just like hypothyroidism tends to be familial, but it's more common on the female side. So that is good for a lot of people to hear because if you have this diagnosis but your daughter hasn't yet, or vice versa, that could be an indication that maybe a missing piece of your puzzle that you'd never considered. So
Mhm.
before we go on more, because this is a term that gets thrown around, but most people actually don't even know what endometriosis is. What is endometriosis?
Sure. So I think I'll start talking about the symptoms and then I'll go into
Hmm.
scientifically what it is. I think it's easier to understand that way. So endo is a systemic body-wide inflammatory disorder that can cause a whole host of symptoms. Now, some people can have one of these symptoms. Some people can have silent endo and have no symptoms.
Mm.
Some people can have every one of these symptoms, but I'll kind of group it from organ system, I guess. So from a gynecological perspective, someone can have pain all month long, or they can have pain preceding her period or during their period or during ovulation or afterwards or half of the month long, all month long. Some have painful penetration. It's typically deeper penetration pain. It can be certain positions. Others can have heavy periods. from a gastrointestinal perspective, usually constipation and or alternating constipation and diarrhea.
Mm.
Bloating is huge, what I see a lot in patients. Some people have painful bowel movements. Other people have been diagnosed with like hemorrhoids or bleeding when they have some bowel movements. Typically, if they've seen a GI, often being diagnosed with irritable bowel syndrome. Other sufferers have like just urological symptoms, like, oh, I got to pee all the time, or I feel like I have a urinary tract infection, but my cultures are negative, or I feel like I have a small bladder, or I go to the bathroom and I need to urinate. There's not much there and I need to go again, or I'm
Yeah.
getting up a bunch of times at nighttime to urinate. But overall, patients often report fatigue. That's like a very common symptom. Also backache, and infertility. It's responsible for 40% of unexplained infertility. So it's so pervasive, and it crosses all like types of medicine. And the problem I know in Canada as well in the US is there's a very myopic view. If you see like a urologist, they're just looking at the bladder. No one's asking sexual health questions or gut questions. You see a gastroenterologist, they're just asking gut questions. No one's
Mm.
like looking at the whole body. And with endo, the reason you need to, because scientifically, what endo is when you have cells that are similar to the lining of the uterus, the endometrium, that's the lining that every month is getting thicker and thicker. And then we shed that lining. So endo is when you have cells that are similar to, not identical to, that lining. However, those cells are found external to or outside of the uterus.
Mm.
So endometriosis is not a disorder of the uterus, it's outside of. So these implants, endometrial-like implants, are found really every organ on every organ of the body.
Mhm.
Typically they can be found if we talk about the pelvis, like the ovary, the what we call the cul-de-sac, that's the area behind the uterus in front of the rectum. It can be on the bowel, it can be on the bladder. It's found like on the appendix, the all of the abdominal organs, the diaphragm. It's really been found in just about every organ of the body.
Mm.
And what happens month after month, our endometrium, or that lining of the uterus, gets thicker and thicker and thicker, and then we shed that lining and we do that all over again. The same hormones that are causing the uterine lining to get thicker and thicker and thicker are the same hormones that are causing those endometriosis implants, which are all over the body that we're born with, to get thicker and thicker and thicker, essentially. And then there's no exit point outside of the pelvis. So month after month, the implants are getting thicker and thicker and thicker, deeper and deeper and deeper. And it starts to pull the pelvic anatomy either like to the right or the left or to the back. And then so there's an anatomical pulling and a distortion of the pelvic anatomy, which can cause pain.
So
And
that
then
could
even,
affect someone's gait and back pain and hamstring pain.
yes, so gait, pelvic floor. That's why I get patients into pelvic floor PT right away. And what's happening within those implants, which I really do think is the key to helping those with endo, is that inflammatory mediators known as interleukins are being released systemically or body wide. So the inflammation could be like on the bowel or on the ovary, but it's going systemically and it's going to the gut and it's throwing off the gut microbiome. It's going to the endocrine system and throwing off the hormones. Hypothyroid is actually one of like a more common thing that I see with endo. It
Mhm.
then starts throwing off the autoimmune system, and those with endo have a higher likelihood of having autoimmune diseases. It goes to every single organ of the body. So that's why when we talk about treatment of endometriosis, medical management like birth control is not a treatment for endometriosis, period. Public service announcement. All birth control does is treat symptoms of endometriosis while the disease continues to progress. That's also why ablation is the wrong surgery. PSA announcement: ablation is not the treatment for endometriosis. Ablation is a very superficial burning of an endometriosis lesion. The correct surgery being excision. Excision is like cutting out the whole implant. Like for those of you who are commuting to work and you're listening to this, like if you can imagine, and for those of you watching, I'm going to just show you my fingernail. If my whole fingernail is an endometriosis implant,
Mm.
ablation is just going to get the white part at the top, very little, but it's going to leave the rest of my whole nail. Excision's going to cut out the whole nail. Because if you just ablate and get rid of the tip, the
It'll grow
whole,
back.
well, it's not that it's going to grow back. That's the misthought in all of the endo review boards, like not the, like the endo dialogues that people have.
Mhm.
It was never removed in the first place. So people say, oh, I had one ablation. I need another because it grew back. I needed another because it grew back.
Mhm.
No, it was never removed in the first place.
That makes
All
sense.
you're doing is getting the tip of the iceberg, but you're leaving the whole nail or the whole implant, which
Yeah.
is releasing inflammation everywhere. And when you talk about ablation, I don't know if any of you've ever left like saran wrap by your stove. I've done it. And like all of a sudden it shrivels up, right? So if already your pelvic anatomy is pulled all the way to your right, then you ablate that endo, it's going to sock it in even more to the right and then pull your anatomy even more, pull the underlying muscles and fascia, totally distort, like what you said, the gait, your movement, worsen a lot of the musculoskeletal symptoms.
Mhm.
You're burying the endo even more, but the inflammation is still being released to the whole body, making it
And
much harder.
increased if
Yeah.
because if your pain or inflammation was, let's say, on a scale 6, now as all these anatomical changes happen, your pain now increases to an 8 because you've got
Correct.
extra issues.
You've got extra issues. Exactly. So ablation is the wrong surgery. Like you do not want to be treated by a general OB/GYN, period. Like you just don't. I always tell my patients, and the system is broken in Canada, it's broken in the US. I've been trying to advocate for this for over 2 decades, and it's like my life's work is that everything I learned in residency about endo was incorrect. And that same misinformation is being taught today,
Mhm.
right? So like OBGYNs think of endo as a period disease. They're going to tell you to get pregnant. It's going to cure your endo. That couldn't be farther from the truth. And bringing a child into this world when one isn't ready. I mean, that's just an insane thought anyways. And who know, not everyone even wants to have a child. So like giving someone that advice from a medical professional, that's totally misinformation. And I learned more, I always tell my patients, in my first week of fellowship than I did in 4 years of OBGYN training plus 4 years of medical school.
Mhm.
So what's being taught even today in 2026 is outdated.
Yeah.
So you really, that's why I wrote my book, because you really need to be your own advocate. You need to be armed with information. There's so much misinformation online to be very careful about where you're getting information. You don't want it from pharmaceutical industries because they're trying to band-aid endometriosis. So you have to be very careful, like whose website is this anyways?
And
Who's
yeah,
giving
there's
the
a big name
information?
around now who is directly funded by big pharma, and I'm trying to like
Yes.
ring the bells, and the
Yeah.
information is so wrong.
Yeah, so you have to really be a savvy consumer, and that is why I wrote my book, so patients can have like this guidebook to go to their gynecologist if that's all they have available, and challenge them with proper information. And in the back of my book, I have vetted resources that I would use for myself, that I would use for my daughter. Like it couldn't be more pure than that,
Yeah,
right?
yeah, yeah.
So yeah, my heart
So
breaks.
we
Still
have
very
a few
frustrating.
things to unpack here, but just again for people, endometriosis doesn't mean you're only going to have pain around the pelvic region. It could be anywhere in your body. It's going to be systemic. Dr. Brian Tracy, a fellow gynecologist, colleague of, well, he's a fellow gynecologist. I don't know if you know him, but he speaks. I heard him speak recently of finding endometrial tissue in the nasal cavity
Yeah,
and
I had
also
2 patients like that in my
and
career.
also some in the brain. And I was
Hmm.
like, whoa, not only whoa, but how dangerous is that to have something like that growing in the brain?
Hmm.
But you mentioned the hormones and their influence on endometriosis here. So I'm curious, um, how to word this because I know it's highly controversial right now. The whole idea of excess estrogen or estrogen dominance. What is the implication on not only being a causative factor in endometriosis, but also exacerbating the issue if someone has a lot of excess estrogen in their body?
I don't think it's a causative factor. I think immune dysfunction is more the causative factor. I mean, there's a lot of causative factors, but I think it's a lot more immune based. I think it's almost like a rogue cancer in the way that that's what I think we're going to find in the next 5, 10, 15 years.
That is
Uh,
scary.
and because those with endo can have a higher likelihood of cancer as well. They have a higher likelihood of melanoma, and they do have a higher likelihood of ovarian cancer if you've had endometriomas. So in my humble opinion, that's where I think the roots of endo it are is. Um, but your question about the estrogen dominance, yes, more estrogen can cause endo to grow more, but what I do really find is healing the gut, tuning the gut up, protecting our environment. That's why in my book, Beating Endo, How to Reclaim Your Life from Endometriosis, I have a whole chapter on the environment. I have a whole chapter on the gut, meaning there's so many pseudoestrogens like
Mhm.
plastics, BPAs, things that we ingest, inhale, things that we're putting on our body as lotions, parabens, things that we're putting on our face or our body as makeup that our body recognizes as pseudoestrogens, pseudo meaning like fake estrogens, but it's still
Mhm.
stimulating the endo. So I really do believe, and it's proven, like if you clean your environment out, like don't drink out of plastic bottles. Like, listen, I don't live in a never or always world. Sometimes I drink out of a plastic bottle too,
Mhm.
but I try to drink out of glass typically, right? And I try to buy products that are cleaner, meaning with less gunk in it. I try and eat food that is cleaner. It's
Mhm.
typically more organic, that's more whole foods, that's not super processed, that doesn't have food dyes. I don't obsess and go crazy and think that this world is scary and fearful. Like, that's not how I live my life. I
Mhm.
just try and make the best choices. But yes, I do think that what healing the gut is the way to normalize the hormones in the body because which then won't stimulate the implants as
So,
much.
with that said, then where does the conversation around birth control and IUDs go? I have a lot of clients, more so in perimenopause, who are expressing all these symptoms that you've listed. They go to the gynecologist for help. The gynecologist gives them birth control, or more commonly lately, I've seen an IUD. And in some cases, it makes them feel better. In some, it doesn't. In a lot more cases, I'm seeing is it makes them feel better initially and then worse as the weeks and months go on.
Well, medical, I'm glad you brought it up because medical management, there was a great review by Tommaso Falcone out of Cleveland Clinic. Um, very well respected gynecologist. And he has a whole review about how medical management is not a treatment for endometriosis. Medical management should be thought of for symptom relief.
Mhm.
Symptom relief, right? So, not necessarily hormonal relief, symptom relief, like of pain.
Mhm.
So, but it's the endo's still there, the inflammation is still there. So, like, let's say you give someone a progesterone IUD or birth control, like you said, what you've been seeing, but then there's still a belly full of endometriosis. They're still eating at McDonald's or In-N-Out Burger. I don't know what you have it, like junky food, right? They're not sleeping well. And I'm not looking to blame people at all.
Yeah.
Their lifestyle, they're not exercising. So then they're heavier set. The more fat we have, the more estrogen actually we create in our own body that gets recycled and then stimulates the endometriosis. So you can't like band-aid a 30-year-old issue with medical management. It's
Mhm.
just going to temporize some symptoms, but we do have to do lifestyle changes as well. That's for sure.
If you do give a woman, let's say in perimenopause, an IUD who has all of these issues, the endometrial tissue is continuing to grow in the background, if I'm
Mhm.
correct, because month by month by month, you're still growing. And the,
Endometrial like that's just like a big sticking point. So
okay,
it's not endometrial tissue. It's similar to.
yeah,
It's
yeah.
a big distinction. Yeah, yeah.
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 So that tissue, though, because of the stimulation, like you mentioned
Yeah.
with the hormones, every month we're stimulating new growth. So even if you're not having a bleed or what you'd consider a period anymore, everything's still growing in the background. But is there a likelihood then that using these more estrogenic IUDs or whatever it is could also be stimulating the growth, not more, but maybe faster?
So the IUDs that I'm aware of are all, so there's the copper IUD, which is
Hmm.
non-hormonal. That typically makes people's pain worse. There's no hormones in that one. And then, at least in the US, all of our IUDs that I'm aware of are all progesterone based. There's no estrogen based IUDs. They're all progesterone based. Like, I
So
don't know
they're
what
progestin based. They're not
progestin based.
progesterone because
Progestin.
progestins are not
Progestin.
progesterone.
Yeah, yeah, yeah.
Yeah.
Like they're like Skyla, Mirena, like they're
Marina's more common here for people.
yeah. Yeah. So they're not estrogen based
Yeah, so
IUD.
they're not estrogen based, but we see in the literature that progestins stimulate estrogen receptors more so.
Correct. Correct.
And
Correct.
just you mentioned the copper IUD. I'm sorry to cut you off. Most people don't know how the copper one works, and please correct me if I'm wrong. But the main way that the copper IUD works is it causes a lot of inflammation within the uterus. Like it causes the tissue to become inflamed, so then it can't be implanted, and you obviously don't get pregnant.
Yeah, it's like cytotoxic to the sperm typically,
Mhm.
but that is not a good choice for anyone who has pelvic pain because that IUD causes heavier bleeding,
Mhm.
typically in worse periods, more painful periods. So that is just not a good choice. You know, a lot of patients will go to the gynecologist, I don't want any hormones, which I totally get. And then they elect that one, and then they're like, wait a
Mhm.
minute, my periods are worse, blah, blah, blah. And also to throw in like another wrench into what you were talking about, most endo patients have very tight pelvic floors, right? Because
Mhm.
the anatomy's pulled to a side, or they're super constipated, so they're straining on the toilet, or they're hunched over, curling up in a ball in pain, which causes like the abdomen, the glutes, the pelvic floor to tighten. When you put in an IUD in a pelvic floor that's super tight, often patients will have worse pain
Mm.
than they had before. So I always get them into pelvic floor PT before I even consider an IUD. That's just a side note.
Yeah, no, that's something I've been recommending a lot more to people, especially if I see back pain that I would think is related to the large intestine. Well, the uterus is beside the large intestine, so it's like a whole system approach. It's not, oh, I have back pain. What's wrong with my L2 or L3 kind of thing. It's
Yeah.
usually more than that, which most people go to pelvic therapy for the opposite of what you said because they feel they're too loose or they have some
Right.
incontinence or something. They would
Right.
never think, actually, maybe I'm too tight. I need help loosening up.
Correct. So you have to find the right pelvic floor physical therapists because most pelvic floor PTs are used to like the patients who are leaking or they have incontinence. So they're telling you to do Kegels, which is to tighten up. Kegels are the opposite of what endo patients need to do. They actually need to release the muscles. So when there's a whole chapter in my book, How to Find the Right Pelvic Floor PT, what questions to ask your pelvic floor PT to make sure you're finding the right one. Yeah.
One of my clients is having issues with adenomyosis, and
Mhm.
she hasn't got a specific diagnosis of endometriosis, which is not surprising.
Yeah.
But apparently, a doctor hinted a couple of years ago that they suspected she might have endometriosis. So they confirmed the adenomyosis. They put her on an IUD maybe 4 or 5 years ago. It helped in the beginning, but now something has, as you referred to, it's shifted in her body. Her back pain is just out of control. There's more constipation lately. And I'm wondering if it definitely was an endometriosis diagnosis that obviously was slightly overlooked. But also, do you see a connection between adenomyosis and endometriosis? Like, is that common?
Oh, it's well reported in the literature. Yeah. I mean, if someone, the thing is, imaging typically can see in the right hands and make
Mhm.
the diagnosis of suspected adeno. imaging is very hard to pick up endometriosis. So I've had maybe 5 patients in over 20 years who only had adeno and did not have endo. So typically,
Oh.
when I see adeno, I'm suspecting endo. So that patient of yours, the back pain could be from adeno, the back pain could be from endometriosis in the uterus sacral ligaments. The back pain could be the structural pulling asymmetrically on all the muscles and the fascia. And the gut stuff is dysbiosis. There was just a paper that came out. I was finding about 80+% of my endo patients also having SIBO, which is small intestinal bacterial overgrowth.
Mhm.
And then they also have large intestinal like dysbiosis. So there was a study that came out a couple months ago that was like 91 or 92% of endo patients have SIBO. So the inflammation from the endo implants are going to the gut, throwing the gut microbiome off, and that's what's causing the constipation. That's what's causing, diarrhea or
Mhm.
bloating. So the it's not that the hormonal management is not working anymore. It's the lack of recognition that when that patient is presenting with the quote unquote adeno, at the same time she has adeno, she probably has endometriosis, she probably has pelvic floor dysfunction, she probably has gut dysbiosis. And if she's got urological issues, she may have interstitial cystitis or painful bladder syndrome. And then there's other associated conditions. So treatment of an IUD for the suspected adeno is treating one of the things. You then need to treat the endo. Endo treatment is excision of endo. The tight muscle treatment is pelvic floor dysfunction. The dysbiosis is getting a SIBO test and treatment and working with an integrative nutritionist to heal the entire gut from the inside out. That is not a day or a week or a month of
Mhm.
management. If you've had gut issues for 10 years, it's going to take you a year to rehab the gut. So the initially it may help the patient because at least you're now calming down one of many issues.
Yeah.
But then the other four are like, hey, I'm here. You got to manage me too. So
Hmm.
hopefully, those out there listening can think of the medical management in a different way. It's treating one of the other things. Medical management doesn't treat tight muscles. Medical management doesn't treat gut dysbiosis. Gender, like it's temporizing symptoms of one thing. It's not even treating it properly.
Yeah, yeah. That's really helpful for people, especially if you notice these symptoms are exacerbated around a certain time of the month, which seems to be the case with my client this month. It seemed to be that she was experiencing all these issues plus swelling of the uterus, which made
Yeah.
me think, I really do think they overlooked an endometriosis
They
diagnosis with
did.
you.
Yeah.
Which is slightly negligible because women are suffering, like your quality of life is down the toilet.
I love that you said that. You are 100% right. Like it is negligent. And like at what point with will the medical community take ownership? Like it's like the life lost, the inability to work, inability to be in the intimate relationships, to live life the way that one wants to live. It's just like for women, it's like who cares? Which is so unacceptable. So I'm so grateful that you just said what you just said.
Mhm. We know, like you mentioned, funding and endometriosis, and funding overall on women's health was very lacking. I think it was 1% of funding each year was going towards, and
Mhm.
even though there's more podcasters, more specialists like yourself speaking up about it, and people think, oh, now we're getting the limelight. No, we're still not. It's still
Mhm.
not enough recognition.
Correct.
It's still being almost hushed or, yeah, yeah, whatever, pushed to the side. And I wonder, is it because of the demand on even family GPs? They don't have time to listen to stuff like this or read. But there's only so far that I think we can excuse them when,
Yeah.
again, it's hurting a woman's quality of life. And in the grand scheme of things, on average, we maybe have 80, 90 years. And if 10 or 20 years of that is lost to you not being able to live,
Mhm.
not only is it negligible, it's sinful. You're stealing life from women.
I totally agree with everything that you just said. I think it's It's multifactorial as to why it's missed. I think number one, the way that healthcare is, I think in both of our countries, it's you need to see 40 patients a day, right? So 40 patients a day is like 7 minutes or something like that. You can't get a history of a chronic illness. Those with chronic illnesses are being missed, right? Mismanaged in both of our healthcare symptoms. The healthcare industry has basically made doctors paper pushers. We spend more time filling out paperwork for approvals, and like we need more and more staff to just get approvals for imaging and things that we know need to be done. Number three, at least in the United States, and this is why I don't take insurance, because and healthcare companies grade doctors based on the number of tests that you schedule for patients and the healthcare dollars that you put towards each patient. So if I have a patient with endo who's been suffering for 10 or 20 years, I'm not going to see him once. Like I need to see him once. I need to see him again 6 to 8 weeks later. I need to see him again 6 to 8 weeks
Mhm.
later. I need to send him for imaging. I need to get him, to be evaluated by the gastroenterologist. I need to send him like to pelvic floor PT. That's a lot of healthcare dollars,
Yeah.
right? So if I took insurance, I'd have an F grade. I mean, I don't really care what grade. I know I'm a great doctor, but my point being is that's what the healthcare system values, little in, little out, right?
Hmm.
I don't want to partake in that system at all. And there's also, the pharmaceutical industry is the largest lobbying group on Congress. And that's a quick 7-minute answer. Take this pack of pills, take this, take that.
Here's your
But wait a minute.
prescription. Mhm.
For all of you out there who are listening, you need to say, wait a minute, this is going to put me in a menopausal state. This is going to give me hot flashes. This is going to give me osteopenia, weak bones, or osteoporosis. This is going to make me suicidal. Wait a minute, why are you giving me this? Like, doctors are no longer our saviors. I mean, if you come to me, we will, at Iris Wings, we are all your saviors. You don't need, I want you to question us, but you don't need to. But I think typically out there, you have to question the doctors, whether it's a GP or a general OBGYN, endometriosis is one of many conditions that they're treating. So there's no way that that doctor can know what I know. I know one disease and I have a really wide depth and a very narrow breadth.
Mhm.
Most GPs or generalists have a very wide breadth and a very limited or superficial depth. It's just the nature of like, are you a master of everything or a master of one thing?
Mhm.
I want to be a master of one thing. Like I know I like couldn't be a good, that's just not the way that my brain works. So it's part that, it's part the education, which is just that's part the lack of funding. And that's why I love that you are doing this podcast because our voices matter.
Mhm.
And, it is the patients who are driving and changing. And when I started working, the first film that I was on Below the Belt, which you can watch, I'm sorry, it was Endo What, excuse me. You can watch it at belowthebelt.film. That was the first film that came out in 2015. We're like, how are we circumventing to raise awareness? Doctors aren't interested because they're too busy paper pushing, right?
Yeah.
Seeing all these patients a day, being told by a nurse manager, you need to see more people. Why are you spending so much time? You're going to be fired if you spend more time with your patients. So we decided to go to the patients with that Endo What movie, and then later the Below the Belt movie, which one of the film members is from Canada who we're following in that film. And you can watch that at belowthebelt.film. It's actually coming out for free on Netflix and I think Google Play some point in February.
That's awesome.
Those films are really helpful to help endo patients navigate
Mm.
um, and and to understand their disease and to have loved ones understand the disease as well and to support them the most. Yeah.
Well, Dr. Kerin Orbuch, this was a lot of information for people. I'm sure they have to listen twice, and I'm sure they've loads of questions and take notes. But I will pop all of your links below. Like I said, I find your Instagram reels quite entertaining.
Great.
So people need to go there. And I've noticed that you will take questions that people post and then
Yeah.
you'll address them. So again, I'm sure people have lots of questions, but for what we got in, I think we got in a lot. So it should be
Yeah.
helpful. And then
Thank you.
your book, of course, can be gotten everywhere. So I'll pop all the links below.
And then for the Instagram, both my sites would be
Mhm.
great. At Iris Wings has different content that at
Yeah.
Dr. Iris Karen Orbuch. It
Yeah,
has different
I follow
content.
both of them. I think I've
Yeah.
messaged you on both of them and
Yeah.
commented.
Yeah.
So if we were to give women just one last line, one last piece to take away to help with their journey, what would it be?
Trust your intuition, trust your gut, trust that there's something wrong, believe your pain, and don't stop until you find the right person to help you.
Brilliant. Thank you. A perfect ending. Thank you for your time.
My pleasure. My pleasure.